Good morning, everyone. And that gives us a little bit of time. My inability to do technology properly gives us a little bit of time to let some people join us. So as I was saying, this is going to be a definitely more casual and potentially a little faster learning community call. It just sort of depends on how much sharing there is to be done today. What I want to do, this is we're ending the second quarter of the fiscal year, and we didn't do this last time. So I want to go ahead and take an opportunity to do it this time. And what I'm talking about is allowing everybody here to share what they're working on going into this final year, excuse me, of this grant cycle. And what are you planning on doing for the next cycle? What's on the horizon for you? And this is an opportunity for you guys to share that amongst yourselves. Obviously, I'm talking specifically in the domain of cessation. And so what we'll be looking for here are places and areas, domains where we can share and potentially over the next year to 4 years, teach each other how to do what we want to do. So there's 16 people who are not me on the line. I know there's some step folks, and I'm happy you're here, but I suppose that in a day like today, you'll just be listening rather than participating. And so with that in mind, I'm just gonna, thumbs up, Micah. I guess I'll start off with letting anybody who wants to pipe in early to go ahead and unmute yourself and introduce who you are. And then if you're here with somebody else from your county, there's no reason to hear from multiple people from one county. If you kind of want to just team up and talk about your counties or your regions or your projects together. I know Sarah's on the line and she doesn't represent a county. I'll just leave it up to you all. Who wants to join in first? And otherwise I'll just start calling on people.
I can go.
Yeah, hi, Daleen.
Hi. This is Daleen Coldglazer from Kit Carson County. It's Burlington. We're on the Eastern Plains, and the few of the things that we have going on is a couple weeks ago I called the pharmacist to see if he would be interested in our tea training. So he listened to me. He met with me, and I haven't heard back from him, but I'll have to touch back. But at least he talked to me.
Yeah.
It's a small pharmacy, so of course he was just more interested, and I wasn't sure what that looked like. Um, After he would get it, what does that mean? I mean, um, just the process of it and how they could bill for it and that type of thing.
So we talked about this during our meeting or when you met Lenny
Yeah.
and stuff. But if anybody else is also pursuing the pharmacy angle, I highly encourage it. I think it's an awesome thing that Colorado is just one of few states that allows for pharmacists to engage in tobacco cessation and the prescription of nicotine replacement therapy as a billable service. I work pretty closely with SCAGs. I help design the training program that pharmacists have to go through in order to get certified to do that. I've also done a couple CEU courses for the pharmacist. So I'm happy, Daleen, if he ever does reach back out to you, you can send him directly to me and we can chit chat.
Okay.
It might be more useful. I can pass him on to Wes Newfer at the School of Pharmacy, who has taken a great interest in furthering tobacco cessation among Colorado pharmacists. And he's a wonderful resource up to and including sometimes being able to place students in the pharmacies who can handle some of that tobacco cessation. I don't know what his capacity is to do that right now, but he's been able to do that in the past.
Mhm.
So
Yeah, he was sure interested, and it said even the techs. So um, there's the pharmacist and the techs can take that program. Is that correct?
I'm not sure that the text can. I think the statewide protocol is limited to the pharmacist,
Just the
but I'm not
pharmacist.
100% sure on that. That's something I can definitely check into. And then Micah, since you're here, in the past, grantees have been able to use their 835 funds to pay for their local pharmacists to go through that statewide protocol training. It's like $200. Is that still a thing that the state is willing to pay for, or do you know?
Yes, I think that would still be allowable as long as you're talking to your project officer and adding that somewhere in your implementation plan. So it's something they can follow up on. But yeah, that should be still allowable.
Awesome. Thanks. Wonderful, Daleen. Who else wants to join or share? Like, everybody's going to share. That's why we're here today. But who would like to
Can
just
share.
jump? Yeah, hi, Lucy.
Hi. So same with Darlene. Like we do have, well, some of you guys have been out here for other calls, but like we're pretty rural, so even hospitals are kind of far away from each other around here. We do have one luckily in this county, Morgan County, and then one in Phillips County. So I think we have talked about it as a team too, to kind of like we do quick hit drop offs to um our pharmacists, and some of them have kind of like stayed back from it just because they say they don't really know how to get so involved as well. And so I kind of, when Darlene spoke about that in one of our previous meetings, I thought that was like something that maybe is very beneficial to our rural areas. Is like the pharmacists, although they're not um seeing, well, they kind of do see the clients like more regular than other
Hmm.
doctors' offices or providers. Um, just because they do pick up their medication there all the time, or it's just available to them, they could just walk in and stuff like that. So that was a good way that we were trying to like incorporate our pharmacists, but also they're already pushed out as far as they can as well. So kind of, we're just trying to see, we're at the point where we're just trying to see what is going to work and where it's going to work
Hmm.
pharmacy wise. And also with the like the cessation part for dentists, I don't know how much more they can go into that besides referring. So that's kind of where we're at.
Well,
We're just like playing with whatever we can and like we're opening the doors to everybody that we have communication with and that we already are in contact with. So I think they're kind of just evaluating how it'll work out for them, and then how we can support them and like get them those trainings that they are allowed to take through us and stuff like that.
yeah, pharmacists do see their patients or their customers, clients, whatever, more frequently than doctors, which is one of the reasons it makes them such a valuable resource. And also, if you're sort of regularly going into your pharmacist's office, especially in our rural counties, you know that person, you know that pharmacy, you know that tech, and so they're just on a much more friendly basis. And then just from a professional perspective, the pharmacist actually takes on a lot of the liability of when a person is prescribed multiple medications. It is their job to say like, hey, this is kind of risky. Can I go back to your GP about this, your PCP, et cetera? And like there are lawsuits when pharmacists do not do that, which is to say they take it very seriously. And when people are looking for nicotine replacement therapy, that becomes an additional medication. So they are perfectly equipped to be handling the conversation about drug interactions in ways that PCPs aren't. So we really like the pharmacists to pick up on this because they're such a critical role. And then on the dentist front, uh, they have so much time because the person is just sitting there with the evidence of their tobacco use glaring in the face of the tech, the hygienist, or the dentist themselves, and they can't talk back. The dentist can say whatever they want, and one of the things they can say is, "You need to call the quit line," right? They wouldn't say it that way because that's not very MI of them, but they can do it. And then it is also the case that dentists are qualified providers for providing tobacco cessation counseling, which means it's a billable service for them through Medicaid. I mean, also probably other insurers too, but qualified providers, a term specific to Medicaid. So there are options there, but of course the dental toolkit that STEP released last year or earlier this year is a really great resource for that. And Micah just put it in the chat for those of you who have not accessed that yet. It is literally the best one in the nation by far. And I'm not just saying that because Chad Morris, my boss, reviewed a little bit of it. Steph did all the work and they did a wonderful job with it. And we have reviewed all the ones in the country and it's just the best.
I'm also going to add something just to Lucy's on that
Yes,
note.
Brittany, also
Um,
from Northeast.
yes, we're from northeastern Colorado. And then we do handle all 6 counties out our way. We have actually got like a contact now with our pregnancy centers. So we do talk to them about the baby me tobacco free, and we actually have them on our list as well to give the quick kits to.
Mhm.
And I actually made up some folders that we hand out now, and they have the quit line information in it. They have um, the baby me tobacco free information. We also give them just different cessation resources.
Oh, I love
And one doctor's office here, or no, it was Ray in Ray. They actually took enough for each of their rooms, and they keep those folders in the doctor's office rooms. That way, they can discuss everything with them when they do their screenings, their tobacco screenings.
Oh,
So
I love it.
that's another plus.
Brittany or Lucy have I think Heather's online too. Have any of you become are you certified baby me folks?
So we've talked about it because our WIC department used to take care of it. But we've been trying to figure out who would be the best person for it because, like I said, WIC was trained for it before, and we thought maybe we could help them and support them by doing it ourselves. But then that would be like passing along a client that, like in so many directions. So we've talked about it.
Okay.
So I don't know where it's fallen through, but there has been talk about like us doing that part of the baby me tobacco free instead of the WIC.
Okay, I'm scanning through the list of people who are here, and I'm not seeing Patty from Grand County. Patty, if I'm wrong, Patty, if you're here, just let me know.
We did talk with her.
Oh,
Yes,
you
I
did?
think we did
Yep.
a one-on-one and we got in contact with her.
Okay.
And that's kind of how we were kind of seeing how it best fits our office. Who would take care of that, just because she did have some really good ideas, and she kind of walked through like how they take care of it and who takes care of it.
Yeah, and she helped develop a little workflow with their pregnancy resource center. So if others of you are thinking about reaching out to specifically that pregnancy, that peripartum population, and you want to know how at least one county is doing it, then we can connect you to Patty for sure if you're not already directly connected to her, like Northeast.
And she is very knowledgeable about that. Like we loved everything and how they were doing it, but we just haven't decided who would be doing it here.
And she has a nurse partner out there who's also working with her on that, who has actually done some tobacco counseling with clients. So that's pretty cool. So they're working both the public health angle and the direct services angle pretty handedly. Cool. Thank you, Lucy and Brittany. Who else wants to share? Oh, I'm sorry, Lucy, you didn't tell me what you're doing for the next cycle. What are your targets for the next cycle?
So since we have a strong team now, because Bree's on our call too. It's me, Bree, and Brittany, all three of us, and we tackle like all 6 counties together. Since we have a really strong team now, we're kind of seeing where we need to prioritize, or people that are like ready to do the next steps. And from there, I'm not sure, to be honest. We're just like so involved right now with being there and supporting everybody, but we haven't really talked about how we're gonna further it like to the next step, just because they're barely opening up to like us being here and supporting them. So we're just taking that, because sometimes like I want to say we want to speak into the future, but I think right now we just need to embrace the fact that they're letting us in, and they're being acceptable to all the information that we're giving them and how to like spread it. But I'm not sure. That's just my answer right now. I'm not sure how we're gonna further it more than just support right now.
When you say that they're getting used to you being there, do you mean, is this like a post-COVID, the politicization of public health sort of recovery, or is it because it's like you're still a fairly new team and they don't know who you are situation, or is it kind of like both?
So it's kind of both, I want to say, because then, like I said, we are a very rural community. Like it takes like an hour to get to each town that we're around. So it takes us like a whole day to drive around to each county in one day. So that'll be like one whole work day. So yeah, just the post-COVID with the schools, and then clinics too. They're like barely getting back into the groove after like all the protocols they had in place and stuff like that. So they're kind of like oh yeah, we can use this information, drop it off, give it here, and like let's see how we can give it to the patients or the clients. Um, so they're open to the ideas and everything that's available to them. But um, as as to the point, like how are we gonna still continue that further on and like give them more support? I don't know yet.
Okay. Yeah. I suppose that there's probably quite a few people on the line who are still in that post-COVID recovery, and it is perennially the case that we are always struggling with. There's a new team member and you've never met them before, and we have these really tight-knit communities, and you are a stranger, and we're going to have to introduce you for the next 8 months.
No, yeah, and I think that's a lot of what we've been doing is like, oh, now like for I was the first one to be on the team after my manager, and then that was like for a couple months, and then Brittany got had to get trained, so it added like like from me getting added on, then to her getting added on, and then us becoming a team, and then now we have a full team with Bree. It's just been like, oh, catching everybody up, introducing everybody, letting them know who they can reach out to, what we have to offer, like the trainings, how they take those trainings, how they get paid for those trainings, and stuff like that. Like they everybody I want to say is open to the resources that we do have, like the training and all that stuff. It's just the time to do it
Right.
already on coming back on board with the time of being full time, basically. So I don't know. It's just a lot. So I think we're just gonna fill it out, and then if everybody's ready to go, like be more committed to like I don't know how to say it, but like be more committed to um being open to more and more and more, then we'll give them more and more and more.
Right. You're not at capacity yet, so you have so much to give.
Yes, yeah. Yeah, and I think that's for everybody. I think we all are very resourceful. They just didn't know, or they didn't have the time to reach out to us. So I think that's where I'm at. I'm like, we're just taking it as it is right now, and then as long as we're in a good space with everybody, then that's how we're gonna keep it.
Cool. I love it. Thank you so much for sharing. Who else wants to jump in here?
Hey Jim,
Hey, John.
John Michael. Hi, how are you? Hi everyone. Hey Daleen, good to see you again. I feel like I'm seeing Daleen like every other day. Um, so yeah, a couple of things that we have going on out in Elbert County. Um, I know Jenny Fisher's not on the call, so I'm going to pretend like she is for a second. She's been working for the last year on developing a pilot program in conjunction with the Elbert County IOG, which in Elbert County is called a collaborative management program. Thank you, Daleen, for connecting some of that for me. And so basically, this group, if you guys are not familiar, these groups kind of convene like county resource officers, department heads, nonprofit organizations, like at a high level so that everyone sort of knows what's going on across all of these different platforms or agencies. And so Jenny worked with the IOG, or in Albert, it's called the CMG, um, to develop this community service pilot program that works with the correctional system and the district courts to have a second chance program for vaping violators. And so we launched this past month. We've already had one youth that has chosen to opt into this. And what this is effectively the youth decide to go through tobacco cessation programming, either Catch My Breath or one of these other quit line opportunities, and then write a paper about it and kind of engage in some type of creative activity as part of their community service effort. And then they meet with me at the very tail end, sort of like as a mentorship piece, which for this first individual was a great launching point because they really want to get engaged. And we think this might be a great opportunity to restart a SWAT program or a peer-to-peer program within this particular school where there's high prevalence of vaping incidents. So, hats off to Jenny for getting this thing launched. And I'm looking forward to, you know, working with other, this is kind of builds momentum, right, into other schools. We in Albert are also very far apart from each other in different towns. And so sometimes it's important to kind of build this momentum and say, hey, look, it's working in this school. Let's roll this over here for policy reasons. It kind of opens the door for a lot of other conversations. Going into 2026, we've got a bunch of stuff coming up. Just yesterday, I met with the HR department for Elbert County. They want to revamp their wellness program, as in they don't have one. So we're going to be working with them specifically around the tobacco piece. But as we all see, chronic disease on the horizon, I think that there's going to be a lot of great opportunities to invite resources from the state and local level to kind of help Elbert County get with the times on some of the wellness stuff. And then we also have a Zen tobacco survey that's going to be getting launched here in the next, hopefully the next month. We were aiming for end of October. This is for those of us out on the Eastern Plains, East Siders, we have some challenges with the Healthy Kids Colorado survey. And we're not getting a lot of data, and we're kind of all tired of hearing that we're a data desert. And so this Zen plant conversation is important because it leans into the eastern part of the state. It is in the easternmost kind of or northeasternmost tip of Aurora. Definitely going to impact Arapahoe County into the northeast. And so we want to get some idea about where people are hearing about this plant, what impacts they think it's going to have, and also ask some, light questions around, use. And so as we get this thing, formalized, I don't want to preemptively say, we're ready to send this out to everybody, but I think this might be valuable for those areas that are having some want to see how the Zen plant is going to be impacting their community.
That's awesome.
So those are some of the highlights for Elbert County side.
I was going to have a question, but Jennifer Schwartz has a question. Go ahead. Thank you, John Michael.
Thanks so much, John Michael. I missed a little bit of what you were sharing. Can you say again when you're thinking of sending out the survey? I ask simply because of the ballot measure that's going to be happening in Denver. But I think you said that you were thinking about doing this in October.
When is the ballot measure? I don't know about that timing.
There's a flavor ban ballot measure for December, and I think we've just got a couple of days here for that vote to happen.
So in terms of timing, just to be brief on that, and we can do follow up. I'm happy to have more conversations about this.
Sure.
We've been working with Chris Jones and some others to formalize the verbiage around that. Obviously, number of questions, different who we're targeting in terms of demographics and that audience. So we ideally had it out there for closer to October, end of October.
Okay.
But again, we can follow up with you, and I know that
No, I
this is
appreciate you clarifying that. That's very helpful.
cool.
October. Okay.
Yep.
John Michael,
Thanks.
a couple things on the survey, and maybe it's too late to make any alterations. Something I'm curious about, and something that I think that other areas of the state might be curious about, is historically what we're seeing with the pickup of ONP is that it seems to be most appealing to people who are already using chewing tobacco. And of course, there are several counties in the state where smokeless tobacco use has a higher prevalence than combustible tobacco use. And so any of those areas, if that remains the case, any of those areas will be particularly susceptible to picking up ONP. So I don't know if you have questions about transitions, like are you using ONP? And if so, what products did you use before, if any? But I think that would be valuable information for you. And then I think those questions could also be transferred to other counties that might want to do similar surveys.
I agree. I will have to go back. I think there might be two questions that sort of touch on that, but we don't want to be have to inferring, right?
Right.
That's the point of the surveys that we actually
You're
have a
right.
number. I can tell you that in a lot of the outlying areas like Agate or in Simla, it's predominantly cigarette smokers still, like
Oh
99%.
yeah, yeah, yeah.
But over the last 2 months in visiting some of the locations out there, the stores have only recently been introduced to nicotine patches. And so I thought that was interesting.
Mhm.
Timing, they were not Zyn, they were competitors. So, if they're trying to get ahead of this thing, I think it brings up some like interesting conversations. And like you said, we should include that in some of the use data as well.
Yeah, if you do, if you could share your survey out to me, just because, like I said, if we can pass it on to other counties, that we kind of have like the same questions going out to different regions of the state, if anybody else wants to do it. I've also put into the chat a recent episode of CityCast Denver. I assume most of you are not listening to CityCast Denver because most of you are not from Denver, but it is in reference to the flavor ban ballot initiative. So we recently passed the flavor ban here in Denver, and now there is a repeal motion. That's the ballot measure. And the interview here is interesting maybe to all of you because it's actually an interview with two vape shop owners. So they're talking about it from the side that we're not used to hearing from, and we're not used to hearing about it from it at such depth. I think the interview is like 30 or 40 minutes. I haven't even finished it yet. So I'm not endorsing anything that's said in it. I'm sharing it for informational purposes only. And if you're in the Denver area, CityCast Denver they're a wonderful team of people. They're very nice. Anyway, thank you, John Michael, for sharing. What else is, and John Michael did not talk about their entire push into the dentist's field, which is what we just spent like 2 hours talking about last week. So,
Yeah, I was going to leave that for Ashley to talk about
oh, okay.
since we have like 4 dentists in Elbert County. So,
Yeah, right. Well, maybe we should skip over to Ashley then, and just sort of fall into ask her
fallen out.
to told.
Thanks, John Michael. I was trying to hide under the radar over here today. Um, so we are, sorry, get my train of thought really quick. We are starting to reach out to, well, we're starting to come up with a plan right now. We're going to be working with the local dentists in Douglas County. Again, giving a shout out to Jenny, who's not on the call, but she did such a great job before reaching out to the dental practices in Albert County to try to work with them to see what kind of tobacco screening they're doing with their patients, to see what kind of resources they have, and just really prepare them with materials, resources, information on the quit line and all the different cessation tools. So we're going to be doing the same thing in Douglas County. We're been kind of working on mapping it out right now, doing some asset mapping, which I know, Jim, you were with us last week here in person working on, just giving us some different ideas and kind of giving us feedback on our ideas with this. So, yeah, it's pretty exciting because I went to the dentist myself last week and my dentist himself was just like, I can barely even get the question out. He was like, yes, I'm on board. Whatever it is, whatever cessation information you have. I mean, I think for a lot of them, they want the information, they want to be able to help out their patients, but it's they're busy with their own things as well, and I'm sure they have some tools and some resources, but it's just not to the extent that I'm sure that they want or have even thought about. So now that we're presenting this to them, he was super super excited for it. Same thing, he wanted us to do lunch and learns and things. So I'm hoping that most of the dental practices will be just as open with that, so that we can really build a good relationship there and help them out with some cessation stuff for their patients.
I love it. Love it. First of all, I like listening to Ashley talk because, like me, she's like listening to a podcast at 1.25 speed. I'm also a fast talker.
This is me slowing down a lot, actually. So it used to be way worse.
Me too. Me too. I was a high school debater, and we had to cram a 16-minute speech into 8 minutes. That's what we were trained to do.
I'm a middle child, so that's all I got.
You had to rush in your opinion because the youngest was picking up knives and running into fires, and the oldest one was
Exactly.
all the attention. Yeah, I understand.
Yes.
I
And
was
so
lonely at times.
oh yeah, and so with the 2020 or the next cycle, this dental plan that we have is kind of we're building upon it, and we're going to continue this into the next cycle as well, and just continue to make things a little bit better and just kind of see where it goes this year. So we do have a pretty in-depth plan so far. So
I'm so happy that you ran into a dentist right off the bat who was so excited to hear about all of this stuff, because it's normally the other way. You have to like trudge through all the mire of disappointment and rejection, and then you find the champion at the end. So it's really cool that you get to start your project with somebody who's already on board, and then
Well, it
hopefully,
helps. Oh, sorry.
oh, I'm sorry, and then hopefully that whatever ideas they have, like you can take forward with you, and just the fact that he exists is something you can mention to others, like, hey, by the way, John's already on board, and they'll be like, wait, John is? I
Yeah,
don't have
and
to be.
we're definitely planning on using that, doing having hoping for some soft handovers. It definitely helps so too. His wife works in public health. So yeah, so there's the connection there and just, a lot of interest. And even I mean the hygienist I talked to before she even asked him, she was like, yes, whatever you have, we'll take it. Like, well, it's, not just giving you things. We want to work with you and talk to you about this and educate and really make it a partnership. But I feel like we're going to get some pretty positive feedback from a lot of dental practices. I really do think that this is something that they know is important. And this is even someone going for dental surgery. You have to, um, quit smoking, quit using all those tobacco products. And I know they can give them the information like, here, you need to quit, go call this, but it kind of ends there. And so being able to help them out a little bit more, I think will be really beneficial because, people don't know where to go. They don't know what to do.
Yeah,
It's hard.
it is. Thank you so much.
Thank you.
And I love it. Who's next? Well, it ain't me.
I'm happy to go next, especially because we're on the topic of dental health partnerships. So I'm with Denver. My name is Bianca Garcia. This is my first year doing cessation with Denver. So I've been here for about a year and a half, and primarily was doing secondhand smoke. Prior to this, I was in Kansas City, and so I did do a little bit of work in cessation and prevention there, youth prevention. So it's not new work to me, but I think I'm definitely learning the community and what we've done in the past. So prior to me taking on this work, Angie Govsick was taking on this work in the area. And so she had started a really good partnership here in Denver with Howard Dental through the Colorado Health Network. So that's something that I just recently took over, and I'm still kind of learning what the plan for that is. And it is nice when you do have a champion on board. And that was part of our kind of barriers and challenges is we did have a really great doctor who was on board and wanted to make this happen. And then unfortunately, they had to leave the organization. So we're trying to work through those barriers as best as we can and find a new contact point person there. But I think we're back on track and starting to make a little bit of progress. The goal is to have some of their staff trained through the tobacco treatment specialist program. And so we do want to do at least 2 medical staff and then 2 clinical staff just to kind of help with their workflow integration. So that's on the horizon. And then more of this long-term partnership, what we're thinking is just working collaboratively with them to troubleshoot what this will look like once they build out a workflow. Because getting the training is one thing, right? But like, how are you going to put this into practice? So that'll be where we kind of go with them next, but it's still very early in the partnership. I think the fact that there's still interest and buy-in is our big win for now. And it's great that it's kind of at this network structure. So we do have the capacity to expand if needed when we get to that point. Um, Aside from that, because I am so new to the work, I've been working with a new team member who just moved over from our outreach and services coordination program. And so he, yes, we do. Yes. So he used to do a lot of services through the Wellness Winnie, which is like a mobile resource unit that would go out into the community, primarily work with unhoused population. And so he just has a really good knowledge of like what's going on in the community, what partners are doing what. And so we kind of sat down together this first quarter and tried to do some sort of prioritization of potential partners with his knowledge. And from that, I think we picked a few really good partners that we want to engage in quarter 2 with the goal of kind of understanding like where are they in this process and how much support do they want from us? Because I think that's something that just from my work in Kansas City that I learned not all partners are at the same level. Like, not all partners are at this Howard Dental level where they're ready to implement and do some workflow changes. Some partners just want resources, and that's okay. And that's still a good starting point. And so I think now that we've outlined a few clinics, a few housing organizations that we want to work with, and then we've got two youth serving organizations in mind, we want to start some of that outreach and get an idea of where are they in this process? Where do they currently fall? And if it's just resources for now, we're okay with that as long as that gets some conversations going and our foot in the door. But I'm not sure if anyone's familiar, but we're wanting to partner with the Stout Street Clinic, Denver Dream Center for housing, Tribe, and then Denver Element to potentially tap into like LGBTQ populations. But that's kind of where we are in Denver and maybe new to the work.
Love it. So for those of you who were not in the first workshop, cessation workshop that we did last month, I hope that you heard, or for those of you who were in that workshop, I should say, I hope you heard some of the things that we were actually talking about, like being active in the things that Bianca was saying. I don't think, Bianca, you weren't there, right? Like, it's just how the work is done. And that's what we are talking about. So for those of you who are kind of new to tobacco cessation and how we do this, the development of tobacco cessation health neighborhoods, I heard a ton of stuff in there, identifying partners, ranking them, prioritizing them in terms of their readiness, and then deciding like what you're going to do with each partner based off of their readiness score. And then of course, what we just heard from Ashley, we're hearing like, we're not just taking from our partners, we're trying to figure out what they want from us so that we can bring that to them and not just looking at what we have and finding people to take it to. Like, we're talking about this stuff and I love it. I'm happy to hear these things are happening out in the real world and not just in my weird ivory tower world. So lovely. Thank you for sharing, Bianca. Who else is next on our in our little sharing circle?
I can go real quick. We don't have a whole lot to share. We are currently in kind of looking towards 2026, dealing with a pretty recent, rather major staffing change. So we're going to have to figure out our capacity and prioritization.
Megan, who are you?
Oh, I'm so sorry. La Plata County Public Health Department.
Hi.
Sorry about that. So anyways, we're trying to figure out kind of how to adjust and best equip our capacity. Aside from that, though, the last couple months we have been trying to rebuild our school contacts. Most of the ones we had spent quite a good time making had been changed out with, position turnover, etc. We were, however, able to do some ahead of school presentations, mainly around second chance, encouraging collaborative conversations around cessation, working on building up some more support for the Healthy Kids Colorado survey. We used a good amount of that data to help kind of re-correct some perceptions, mainly around intent to quit within youth, as well as kind of how or what the contributing factors for youth using. A lot of the teachers we spoke with were rather surprised at just exactly how the marketing tactics are so potent and to the point around really trying to just get more users, more youth engaged. Aside from that, though, we are building a little bit around our two more rural counties as well. We're working with the new counselors at Bayfield, and then we are also working with a brand new student wellness coordinator in Ignacio. Really interested in getting Second Chance started there, so we are just trying to trudge along as soon as the pace of trust allows.
At the pace of trust. What a wonderful phrase. Thank you, Megan. Who else is next? I see some people that I want to hear from, but I'm not going to call anybody while there's still volunteer opportunities left.
I can go next. Casey Pierce.
Hi, Casey.
My pronouns are she, they. I work for Boulder County, used to work in Weld. So lots of different viewpoints. Our IP does not specifically call out like cessation, but it's, as part of like the foundational stuff. But one thing that we have been working towards is we have a program that's for teen pregnancy, and then also siblings of teen parents. And so those are interactions with a nurse with them, and they follow them throughout their pregnancy and after their pregnancy. And so we're working with their program to get cessation services through them. And I'm exploring currently like Baby and Me, tobacco-free stuff. Jim, do you know, like, I remember like many years ago when I was at Weld doing the Baby and Me tobacco-free like certification thing. Is it a one and done thing, or do you have to do it periodically?
I don't know the answer to that question. I think it's one and done, but does
Okay.
anybody else on the line happen to know for sure about the Baby and Me certification? I can definitely find out because we have some people, some of my coworkers are certified and have been promoted
Yeah.
around the state, so I can ask them.
Hi, Jim. My name is Teresa Anderson. I'm the program manager for Baby and Me.
Oh, so you probably know the answer to the question.
I do know the answer to the question. Hi,
Wonderful.
Casey. Good to meet you. The certification needs to be redone every 2 years.
Okay, so then I need to redo it. Okay, great. Thank you. And then Jim, I've been thinking about you lately because it's
Horror movie season.
horror movie season, and I was just thinking about you as we were pulling up some good ones to watch. So
Yeah, you should tell me what your October schedule is going to look like. I'm just starting to put mine together. But Weapons is on the list. Everybody has been telling me to go see Weapons. So
go say that one again.
Weapons.
Oh, okay, yeah.
Have you seen it?
No, it's on my list.
We'll share notes later.
And I'm Tessa Kroom. I'm the director of the Baby and Me.
Hi, Tessa.
I've just been kind of listening, and I'm happy to answer any questions about Baby and Me also.
Yeah, I saw you on the line, and when Casey asked the question, I'm like, do I call Tessa out or do I wait?
Yeah, please do, because I'm kind of also working on some other things.
Yeah, no worries. But yeah, so and Tessa is extremely friendly, and so you can reach out to her. I'm gonna say anytime really with questions.
Yes, please. And Teresa is my wonderful program manager.
Cool. Yeah, we've been promoting the program around the state whenever we go out, so or hoping that it helps.
Yeah, the certification is not that onerous for Baby and Me. It's a 2 day with 4 hours virtual training on each day. So kind of a morning of training over 2 days. And then we provide all of the materials that you would need to implement Baby and Me in your community and really streamline the process of fulfilling all the incentives and sending all the supplies that are necessary. So if your agency is considering it, we know it's so much more impactful when it's delivered by people in the community to their own patients that they know and understand. So we are happy to work with you, and we have, I think we're up to like 8 or 9 in-person sites now around Colorado. We have a lot more sites that are coming back, not online, but in person. And we can certainly put you in touch with other communities that have integrated it into their various workflows.
And I'll just add that, Baby Me has wonderful resources for the pregnant individuals, but sometimes it's just the social connection that matters. That living presence that's nearby, that's saying that we care about you and we want a better future for you and your baby. Which is to say that it is a real. It's what BHBP wants to do is build local resources, and connecting with Baby and Me and getting somebody local to handle this program for you is a really easy win for building local infrastructure around tobacco cessation. So if you aren't considering it, I highly, highly recommend that you reconsider your consideration and try to get somebody who can do this for you.
And I'll go ahead and pop my email into the chat
Good.
if anyone has any questions or wants promotional items or anything like that. So feel free to reach out.
Cool. I did not plan for this to be a Baby and Me promotional hour, but we've now had 2 people. It's happened twice, so it's just happening naturally. It's dentists and babies. That's what we care. Teeth and babies are the subjects of interest this year.
And your teeth sometimes get worse when you're pregnant, so
Mine
there is
survived
a
it,
connection.
Yeah, that is right. The babies, they want your bones. They
They suck the life out of you, literally.
Yeah. I'm glad you said it and not me, but yes. I'm gonna call on Peter, just because Peter, you're logged in on your phone, and I'm gonna need a record, a reminder that it was you that was logged in as your phone. And you always have a lot of pans on the fire. That's what I wanted to say. Can you unmute yourself and share a little bit of what's going on way out west? Maybe not. Maybe he can't. Sometimes the phone logger's on. There's a reason they're on the phone. But the recording of my own voice calling him out by name will be a reminder that he was here today for me. Who else wants to share? We're in our final quarter of the hour, and this has been wonderful so far. So. Well, then I will start calling. Robin Mills from Delta. Can you share with us a little bit of what you're working on now, what you're going to be working on over FY26? Maybe not. Maybe Robin can't either. What about Alicia Garcia? Just going in order of how you appear on my screen at this point.
Jim,
oh, hey.
Peter Mueller. Can you hear me?
I can. Hi.
Hi, sorry.
That's okay.
Good. Pitkin County and Garfield County Public Health, and we are working with an organization called the Hope Center, which operates in a dozen schools throughout Garfield and Pitkin County, and they do they're school-based mental health clinicians. So they work on health and wellness in terms of mental health and wellness for students in the 2 different counties and the 4 different school districts. And we're working with the Hope Center to get them and their clinicians trained in the tobacco treatment specialist offering from CU's Behavioral Health and Wellness program. And we're just excited. We just feel like that's a great hole to plug. As somebody mentioned, it's really hard for students to connect to My Life, My Quit and kind of sustain that effort. And so we think that the Hope Center is going to be a critical partner in helping deliver services to kids who are interested in quitting their tobacco habit.
Love it. Yeah, wonderful. Thank you for sharing, Peter. And then I think Brianna is the Bree that Lucy mentioned. Is that accurate? And Lucy can chime in here if that is the case.
Yes, that is correct.
Great. So we've already heard from Northeast. Great. So Michelle from Otero. Can you chime in a little bit about what you guys are working on in the Southeast, which I insist on saying Southwest, even though I know where it is.
So yeah, we cover 9 counties in Southeast Colorado. So we have been doing a ton of outreach now that it's fair season or was fair season. So we have been talking to people, trying to get people signed up for the Quit Line, Freedom from Smoking. We've also been promoting the tomorrow, the Be Strong for Tomorrow. And then we are also in and out of all the schools and getting them signed up for a second chance to help the kids quit vaping and smoking. We are currently looking for some different healthcare providers to work with, get trained, and then we have people in every county that we work in that are trained for freedom from smoking, so they can provide those resources to the community.
Awesome. And that is, for those of you who are not as familiar with the state, that Otero County region is so large. It is bigger than like the entire mid-Atlantic part of the country. I'm exaggerating, but it feels pretty close. It is. I feel like you just get lost down there sometimes.
Yeah, we have put a lot of miles on our vehicles this summer. So
you in the Northeast, those are the 2 like really like large stretches for a single office to maintain. What about Thea Rodriguez? Thea.
Hi, it's Thea.
Thea, sorry.
No, that's okay. I'm with Pueblo County, the Pueblo Health Department. This year we're doing billboards for My Life, My Quit. It's a like a continuation of a campaign we did last fiscal year where we reached 500,000 people. So that's amazing. So we're doing billboards this time around, and hopefully we get more enrollments in My Life, My Quit, especially for youth. Then I'm outreaching and building partnerships with some clinics right now to be able to provide quit kits. I was able to provide quit kits to our still mill here, Rocky Mountain Still Mill. I was able to provide 3 quit kits to them. And then we provided 5 to our MXV Rail um, organization who does the railroads. And I'm in talks to do a presentation for our District 70 school nurses to be able to provide quick kits to their clinics.
That's awesome. That's a lot of big moves since the last time we talked.
I know. It's exciting.
Very cool. Thank you for sharing. Who haven't we heard from at this point? Frank? Abby's put stuff in the chat as has Brittany and Heather. Your team's already spoken, but you're also welcome to join. But yeah, Frank, I think is the last person we haven't heard from. And maybe we won't hear from Frank, which is okay. Some people are microphone shy or their technology doesn't allow for it. Well, y'all, I think this has been wonderful. It's been great to hear from what everybody's doing. I'd like to hear that there are some similar themes emerging around the state, which presents an opportunity for you all to connect outside of these calls to take advice and consult from other people working in the same areas. I don't know. We have Jennifer and Micah from STEP. Is there anything that you guys want to add in the final minutes of this particular call? Any updates from STEP that might be pertinent to this group?
I don't think so, but thank you.
Sure.
This is Jennifer, by the way. It's been a pleasure just hearing what everyone's working on. I just love hearing about what you're doing in your community.
Yep.
Mike, did you have anything to add?
Oh, yeah.
Yeah, right now we're just working on some minor updates to the framework for next cycle to help make it clearer or provide examples. And so hopefully even next grant cycle will be even better and easier to work in Strategy 3.1. So very exciting to hear everything though. Thank you.
So in the next couple weeks or so, some of you will be directly hearing from Lenny. We're going to be trying to bring back a feature that we used to have here for these learning community calls, which is featuring you and your work. So we already have some ideas of some things that we heard during our IP updates that we want to feature. So some of you will be getting calls or emails from my peer here, Lenny Romano. But the invitation is open to all of you. All of you said today some wonderful things that you're working on. So don't think about this invitation as a request for success stories, things that you've already accomplished and you want to brag about. That's not necessarily the goal, although certainly if you have those, we would love to hear about them. It's really just more a more in-depth dive into whatever you're working on and at whatever phase you're working on it. Any number of the things that I heard today could be a feature for that sort of thing. And what we're trying to do is, what I normally do is if you agree to be one of these featured people in one of the quarters, is what are you working on? How did this, why this of all the ideas? Like, so, why are you reaching out to dentists? Why are you working with the school, the Hope Center, etc. And then so why, and then how far along are you? What barriers did you anticipate? What barriers did you actually run across, and what did you do to overcome them? So essentially, the way I summarize it is, if somebody were asked in another county to replicate what you're doing, what do they need to know to do that? And Frank, I see you've come off mute. Did you want to share real quick? Or no, he's remuted. No, he's unmuted.
No, I was just saying I was having some microphone issues, so sorry about that. But I'm going to be working with the STEP program at the state to build a portal for people to go onto and order the cessation materials, and then drop ship them out. So looks like I was invited to learn about what the program and what everyone is doing to work on it. My next phase will be to figure out the video.
Oh, that's cool. All right. I'm glad I called on you. I've been wanting to hear an update about how that was all going. So it's
Yeah, I
happening.
think it's in the first approval was done. The second approval is being worked on, and then we'll start building that probably by the end of Q4.
Cool. And Frank, what is the organization you work for, just so I can jot it down?
I work for a place called Frederick Printing, R.R. Donnelly Company. So when the state reached out with an RFP for creating a program online, we won that back in wherever the middle of the summer.
Awesome.
But the Public Health Board needed to approve the budget, I guess.
Yep. Red tape's everywhere.
Yeah.
All right. Thanks for joining us, Frank.
Yeah. Thanks for the invitation. I'll look forward to the next one.
Cool. So yeah, the invitation stands if you want to be featured in one of these, and it's normally 10 to 15 minutes. It's not a huge ask. So sometimes we can do one or two of them in a time. If we get enough people, then we'll try to theme the conversation so it's around a specific topic. So if two of the dental groups wanted to get together for a day, that would be awesome. Maybe later in the year, once you've actually gotten to do some stuff, make some contacts, etc. Just let us know. I will be sending out my normal, extremely brief survey about this presentation. It will ask, or this LCC, it will ask you what topics you want covered for the next ones, and we always try to be responsive to that. So normally not a lot of people give us ideas, which means that if you're the one person who says, I'd like to hear this, then guess what? You're going to win. You're going to get to hear about what you want to hear about. If there's a competition, it's a good problem for me to have to solve. So please take the time. It takes literally 2 minutes to fill out the survey, or less, depending on how quickly you click the number 5 button, 5 out of 5 satisfaction. And I'll see you all. I was going to see I'll see you all next time. We are pre-scheduling these. Lenny and I sat down earlier this week, and we have dates for the next 3. I'll be sending out calendar requests for the next 3 of these that will close out this fiscal year for LCC. So you don't have to worry about me springing these on you 3 weeks beforehand or 2 weeks beforehand. With that, I give you back a whole minute. We'll talk soon. Bye, everyone.